take a look at what this really means. And it may sound like a great idea on the surface, like lots of things, but when you look at as I said, the devil's in the details. If you look at what the actual implications are for you and your family and your health care, this is a really bad idea.
We're joined on the Daily Signal today by Marc Palazzo from the Coalition Against Socialized Medicine. Marc, thanks for being with us.
Oh, happy to be here, Robert.
You know, this is an issue that's obviously getting a lot of attention. We see it in the presidential race. We see it in the polls. Healthcare continues to dominate. Tell us about the coalition and what it is you're trying to do.
Sure. Our coalition was established the middle of last year, and we're comprised of 25 leading conservative groups, of which Heritage is part of it, so we're grateful for that. And really, we came together because the threat became so real. I mean, anyone that's watched the Democratic debates has seen that the idea of socialized medicine has moved from a radical idea in the left of the Democratic Party to the center of the Democratic Party. It's almost a disqualifier for running for president as a Democrat if you're not for some form of socialized medicine. So the folks at ACU and Matt Schlapp and Dan Schneider really took the lead and decided that we needed to put together a coalition and have everyone together speaking with one voice. So that's what we've been trying to do for the last 6 or 8 months. Doing a lot of earned media communication to try to educate folks, doing some paid media campaigns as well, and other things.
Let's talk about socialized medicine, because that term, when you say it like that, obviously sounds pretty drastic and something that would not be appealing to voters. However, it seems that the left has come up with some clever code words that they use when they're really describing socialized medicine. So walk us through some of their code words: Medicare for all, single payer, those types of things.
That's what they are: single payer, Medicare for all. And that's exactly what they do. They try to disguise it. But what's concerning or threatening for us is that if you poll on the issue and ask the American people how they feel about socialized medicine or Medicare for all or single payer, it polls well. I mean, intuitively, people would say, yeah, it'd be great if everyone had wonderful health care, and that would be a good thing. I think we'd all agree on that. But when you start to provide, the devil's in the details, and you start to provide the American voters through polling, as we have, some of the details, like it's going to cost over $32 trillion, estimates say, over 10 years. And your taxes are going to be increased. Even Bernie Sanders has acknowledged that if you have private health insurance, maybe even through a union that's negotiated for you, you like it, you like your doctor, that's going to go away. You're not going to be allowed to have it. That the quality of care is going to dissipate. It's not going to be as good. That price controls will be in place. Never worked in any sector. But what that means, the ramifications of that are no new medicines. If there are price controls in place, there's going to be less resources, less incentive to develop new medications and new cures. So, I think most telling is the government will be in control of your health and your family's health care decisions. The government will make decisions.
And we have some real life examples of this in other countries. So, I mean, when you're talking to people, I mean, do you talk about Great Britain or Canada or use other examples about where care has diminished as a result of the government stepping in and taking more control over your life?
Oh, we do that all the time. I mean, I was on a panel yesterday with a woman from Europe talking about that very fact. I met a gentleman the other day from Canada who talked about the many friends that they've lost who have passed away because they've been waiting for treatment that they couldn't get. And that many others come to the United States. He said Texas, Arizona, they're coming to hospitals there to get treatment, So it's not the panacea that the Democrats present. And I think the American people are going to be, once they learn about it and they're educated, will be in opposition to it for sure.
We already saw under Obamacare the government take on a greater role over health care and the backlash that I think the President Obama suffered as a result of that. Did those lessons not stick? I mean, it seems that they're not content with that and they want to take it to a whole new level.
Yeah, I don't know. I don't pretend to know what goes through their minds, if anything, but the rise of Bernie Sanders, the godfather of this issue, he has been. I'll say he's been consistent with a bad idea for a long time. But what's troubling is that as we've seen, as I said in the debates, that most of the other candidates are adopting the language because they feel like they have to. So I don't think it's. I think, as I said, I think ultimately if we can educate people and get them up to speed on the issue, it's a winner for our side, and I think we'll prevail and preserve healthcare in the United States. Now, is our healthcare system perfect? No. My wife's a nurse. She'll tell me every night when she comes home the problems, and there are issues, and we need to address them. But a dramatic shift in philosophy and to go to a socialized single-payer system, I think would be terribly, terribly wrong for the American people.
President Trump has said he wants the Republicans to be the party of healthcare. What are some steps that you would advise that they take, whether it's in terms of messaging or developing policy?
Well, you got to be for something too. I think that's important, and I think that's the one thing we have to work on is really, we came close to making some modifications at one point, but I think talking about what we're for is a good thing, and I think we're all for quality health care. We want improved health care. We want it to be cost effective, and we want it to be smart about it. So I think everyone would agree on all sides that there needs to be some modification and changes. It's not a perfect system, but it's a heck of a lot better than what they have in the UK. I joke with people, Mick Jagger came to the United States for his heart surgery for a reason. And I think that I think we're fortunate that we have the healthcare system and the doctors we have. I'll give you a quick example, if I can, a personal example.
Sure.
Like lots of people, my family faced a health challenge 5 years ago. My 22-year-old daughter at the time was diagnosed with stage 4 thyroid cancer, out of left field, and she's perfectly healthy. So when we got over the stun of that information, my wife and I and my daughter, we needed to identify surgeons. She needed surgery immediately, is what the doctors told us. We identified surgeons, endocrinologists, and folks that we wanted to be on her health care plan, to direct her plan. So we picked those doctors and literally interviewed them and decided who we would have. And she was able to have surgery within 3 weeks. When she had the surgery, the surgeon told us she went in at 6:30 in the morning. He said, I should be done by noon. He came out at 1:30, told my wife and I, this is the most extensive case he's seen in 30 years. He needed 3 more hours, and that my daughter had cancer since she was a little girl. So it was shocking information, to say the least,
wow,
as parents. But the good news is that her surgery was 10 hours, was successful. 5 years later, she's working on the Hill for a senator and graduating from Georgetown Graduate School in 6 months and is doing great. But if Bernie Sanders was president 5 years ago and we had a socialized medicine system in this country, there's no doubt my daughter would not be alive today. And I think that's the kind of story that they're not telling. In her case, she would have been diagnosed with a cancer that's very slow moving and slow growing. So you can see what would have happened. Some bureaucrat would have said, well, that we can manage that. But even the doctors, until the surgery was commenced, didn't realize how severe her case was. So there's lots of cases like that. There's lots of cases in these European countries where people never get to treatment. I mean, you're not going to go just get a knee replacement. And what's more alarming is comments like Mike Bloomberg made, talking about a 95-year-old person, just go home and deal with it. So what's the age? I mean, what's the cutoff with Mike Bloomberg or Bernie Sanders? Is it 60, 65, where we tell people, sorry, we can't help you? I mean, it's inhumane. It's bizarre, really, if you ask me.
Thank you for sharing that story, Mark, and glad to hear your daughter is doing well.
Yes.
This is, after all, an election year, so Americans are more attuned to politics and policy debates maybe than they normally are. Talk about some of the efforts and initiatives that the Coalition Against Socialized Medicine will be doing. You talked about some paid advertisements and education. Where are you going to be? Are you going to look at targeted states? Or are you doing nationwide?
Exactly. Well, right now we've done a fair amount of polling nationwide. We did some polling in New Hampshire around the primary up there. Got some very interesting data, specifically relating to union households being dramatically opposed to this issue in New Hampshire. So, and we weren't surprised to hear that.
We even saw it with the culinary union in Nevada,
exactly,
right? Yeah.
Exactly. So we're going to be continuing to gather data, and we've done some targeted paid advertising in some congressional districts already, but I expect that we're going to continue to be very, very active in that regard, try to utilize our resources effectively and efficiently, and really just be out communicating to the American people. Take a look at what this really means. And it may sound like a great idea on the surface, like lots of things, but when you look at as I said, the devil's in the details. If you look at what the actual implications are for you and your family and your health care, this is a really bad idea.
We're talking to Marc Palazzo, and it's the Coalition Against Socialized Medicine. Heritage Action, a lobbying arm of the Heritage Foundation, is a member of the coalition. Mark, where can people go find more information about your coalition?
Well, our Twitter feed is at say2socialmed, and our website is nosocializedmedicine.org.
Great. Mark, thanks for being with us.
Thanks, you, Robbie. It was great to see you.